Well, I was just thinking that when we carry clinical responsibilities, team sport is the most important part. Joanna, you
Yeah.
made me reflect on how we work in tumor boards, right, Nikki? When with all our teams, um, the type of tumors, many of them that I do in my consult, I do work closely to radiation oncologists. I am very thankful for how much therapies have improved in the last 10 years. I mean, SBRT, you have new radiosurgery, you have so many new options for patients that are in a metastatic setting. I think it's amazing. Um, how it has developed in the last years thanks to research as well. So reflecting in all the responsibility we have as doctors, as oncologists, we should probably now move to well-being. I think it's a beautiful bridge to what brought us together, how we met. Joanna, Nikki, and we met at the ESMO Resilience Task Force workshop in January. It was a wonderful workshop.
Yeah.
Yes.
So it's clear that your work and our work, I should say, demands not only great responsibility, but discipline and a lot of resilience. So, with that in mind, you've led well-being initiatives, Nikki, for all of us across the medical community, for RCR. So, from your perspective, what does well-being mean in medicine? What does it look like?
Well, I think it looks different to different people, and there will be some health professionals who do jobs where you think that would be very bad for my well-being, and there are others who have a completely different approach. So there is not one definition. It's very individual and depends on you. But um, whatever makes you feel good, it's the feeling good, is being happy, being feeling that you've got the right balance between work and home. Always challenging, and I think we all probably do too much, and we'd say we haven't got the right balance. But actually, most of us are here because we love being busy, and if we weren't slightly too busy, we might feel slightly unloved and and start worrying. So I think I think it's very much individual, but I think that enjoying your work, feeling that you actually the way you work allows you to have that time, to give that time to patients, to that you're not rushing, that you're not thinking, I didn't look at that plan properly. What happens if there's a mistake on it, because you just haven't got time. If your work starts to feel like that, and you're constantly anxious about the fact that you've got too many patients to see, you're not able to see them, give them the time that they need, you don't have the time to look at your radiotherapy plans carefully, you're rushing to you're rushing such that you're at risk of making errors. If that's constant, and that doesn't ease over time, then you have to start stepping back, and you have to start disengaging and saying, actually, I can't worry about every plan that I may have made a mistake on. I'm not going to. And then that stepping back, disengaging becomes burnout. And and I think that, so it's being in a good place. It's not about not necessarily working hard. We all work hard, and most of us thrive on and working hard. But it's having to fit too much, such that you can't do the job that you want to, a good enough job that you want to do. And then you need a way of switching off, of relaxing. And again, that's different for different people. Some people, I like to go for a long a long walk in the Welsh hills. Um, Others, for other people, that would just be awful, and they preferred to play a game of football. It's very individual, but there needs to be a way of switching off. My husband has just, well, recently, I say just about 3 years, he started to play the piano, and he it's great because I can see he's practicing and he just switches off. The only thing that he's thinking about when he's practicing the piano is what each hand is doing. So you need something that you enjoy, something that gives you pleasure, and it doesn't have to be some fantastically exotic hobby. Something simple. Enjoy your friends, your family. You need a safe place to go home to. All these things, nothing immense, but just little things that make you as an individual happy as well.
Yes, I fully agree. Genuine well being is like not just preventing burnout, but about creating a culture where people feel seen, supported, and also being able to find space for their own well being. I think it's very inspiring to hear about efforts to bring well being to the forefront in medicine, especially to talk about this in oncology. I want to ask you, Nikki, personally, how do you look after your own well being?
I monitor, and I think during my career, it's been almost subconscious. But if I haven't felt happy doing something, if I felt that I can't give the care that I want to give, I've generally been in a situation where I can say, right, I'm going to change things. And I got to the point in my career, I was doing pediatric radiotherapy. I was doing it in a smaller centre at Clatterbridge. I was seeing smaller, decreasing numbers of children a year, um, because they were going for proton therapy abroad. And I just felt that I wasn't able to maintain my skills, my technical radiotherapy skills. The team that I was working with were excellent, but they were saying, "Look, we're going to retire. Nobody else is going to want to anaesthetize 10 children a year, um, at a radiotherapy centre." And I felt very strongly that I wasn't happy. I did not feel that the service was sustainable, and I was very fortunate that I had an option there. I took I had the choice of moving to the Christie and moving my paediatric photon practice to the Christie as well. More easily said than done, because there was quite a lot of resistance to that, not among patients, not among families, who would say, a mother said to me once, I would go to Mars to access the best care for my child. Fantastic quote. But it was colleagues, who felt that not necessarily colleagues at Clatterbridge, but paediatric oncology colleagues, who felt very threatened, that they felt that if we lost radiotherapy in Liverpool, then that might threaten the care that their service at Alder Hey. And there was a lot of discussion and a lot of creating an understanding. And again, it was that a lack of understanding about the importance of radiotherapy and technical radiotherapy, and you cannot give craniospinal irradiation safely if you're just doing one every 3 years.
Yeah.
So being able to change that, and around that time also, my breast practice, it was an old fashioned sacked radiotherapy, adjuvant, metastatic, everything,
Yeah.
end of life care. It was becoming increasingly complex, and the clinics were increasingly difficult decisions to be made for large numbers of patients. And if I'd have continued in that clinic, I would have started to burn out because it was unmanageable.
Yeah.
But I stepped away, and myself and a colleague retired, and I stepped away from that. I was sorry to say goodbye to my patients, but actually that was an impetus for the service to change completely, and new oncologists came in, and so that was restructured. And I think that, again, it maybe wasn't a conscious decision, but it was the right decision at the, at the time. And while I do miss my breast practice, I embrace the fact that I'm in a position where I really can, working in a team, seeing just children in a national referral centre. We take patients from the Republic of Ireland, so we could call ourselves international. It's fantastic. I see, we have 20% of our our treatments are craniospinal. That doesn't make us cleverer than anybody else. It just means that we've got experience. We're doing it every day, the whole team, the radiographers, the physicists, everybody's doing it every day. And if you're doing something all the time, you 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 become more experienced. Everybody's skilled. Everybody just knows what they're doing. And if you're doing something once every couple of years, you just can't with the best one in the world. So I've been really lucky, I would say. I loved my time at Clatterbridge, made such great colleagues, great friends, but it was time to change the way that I worked, and I had that opportunity. So I was very lucky. Not everybody does.
I can't agree more, and thank you very much for this honest answer to Wilma's question and reflections. Change can be painful, but frequently is necessary for a number of reasons, and it's always multifactorial. And it's important. It starts with self-awareness. That is what I was thinking, what do I want to say here? It starts with self-awareness, knowing where you are, what the issues are, what is within your level of control, what change looks like, and then plan for change. You mentioned that you said, I'm lucky. I don't believe so much in that. I think it is your who you are and your journey led to this. It's not a matter of it's not a random thing. This is what I'm trying to say. But thank you so much for this honest reflection. I think it a lot will resonate, including myself, and it's liberating hearing that from you.
Oh, thank you. And what I would say, I agree. Change is really difficult.
Very.
It's so difficult, and I think we also have to appreciate that within each other.
Yeah.
That, and I know, having gone through this change, I spent quite a lot of time burying my head in the sand because I did not want to change my whole, just commuting to Manchester. I had a 5-minute commute before, and now it's an hour and a half. Again, I think there is some luck. It's
Yeah. Yeah.
incremental bits of luck and other things, but it came at a time when my children were going off to university. I couldn't have done that, made those changes without that.
Yeah.
If I was still having to be somewhere at 5 o'clock on the dot to pick them up from nursery, or even early to pick them up from school, that would be very difficult. So I think there are so many different factors that come into one's life and how it turns out. As I say, I would never have thought that I would be just treating children at this stage in my career. But
I know,
who
but
knows?
change is good. It is painful, but change is good, and
Yes.
it depends on the person. There are people who feel more comfortable not changing anything and being in the same environment, and that's absolutely fine, and they're very happy. Whereas there are others that do like the challenge, want to go in a different environment, develop there, and actually they push the boundaries and they develop themselves as well through the change process.
Yeah, I think everybody's it. I didn't want to change. I was very happy. I really didn't. And it was difficult for the first 2 or 3 years. I knew everybody at Clatterbridge. I knew the gardener, the porters. They knew me. You walk down the corridor, you know who you need to ring to get things done.
Yeah.
I came to the Chrissy. I had no idea, and it's only in retrospect you look back and think it was a tricky 2 years. Everybody was lovely. I worked with a great team, but it's still that that sense of not belonging. And obviously we know that for well-being, that is so important, that belonging. And I think that's what many of us don't have in the same way, because we work remotely. And if you're a consultant starting out now who hasn't developed those relationships over the years that we have done, off face to face, and it's all, I think it's very difficult. And I think that is a big driver
Yeah.
for the poor well-being, if that's a phrase, that we're seeing among colleagues. We don't have those informal, supportive corridor conversations, or knocking on somebody's door, say, "This has happened. What do I do?" And not much you can do, but you can at least listen to them, make a
Yeah.
coffee, and sit down and say, "Don't worry." We don't have that opportunity anymore. I'm sort of going off piece, but I think it's a really important thing to say about well-being. It's about human connection as well.
Exactly. I fully agree. I think it's a huge inspiration, Nikki, what you've told us right now, that change. I mean, it's like Joanna, you were saying, change is sometimes scary or frightening. You need to have your priorities very, very defined, and then from there on you can actually improve and move on to new things, new goals. So I think it's a huge inspiration, Nikki. Thank you
Oh,
for sharing that with us.
my pleasure.
And I must say that I think we should communicate more. I agree with you, Nikki. Actually, now while we're speaking today, it's nice for me, like having this conversation with you too. I really feel like, I have colleagues who feel the same as I do, have doubts, have worries, think about change and how it can happen in our daily lives in a daily basis. So I think we should really try to communicate more with our families, colleagues, friends, and also patients, of course. Communication is key,
Yep,
definitely.
absolutely.
So, Nikki, before we close, we always like to end with a quick reflection round, rapid fire answers, and big insights.
This is the
What?
worst bit.
Yes.
This is our favorite. We
It's our
love
Oh
this.
no.
It's our
Yes.
favorite part.
favorite one. What is a quote that keeps you going?
I oh, I think the golden rule is that it sounds very big, but it's small. It applies to all of us. Treating people in the way that you wish to be treated. If you try and follow that, and obviously it doesn't always work, but if you try and follow that, if you're prepared to walk in other people's shoes and just try and see things from their point of view, try and understand. I think that is that makes for a contented life as a human being. We're not Nobody's perfect, but if that's your aim, then I think you go some way.
That's a beautiful quote, Nikki. One part of your job that people often overlook.
I think we've talked about radiotherapy planning.
Yes.
I think that contouring, sitting there contouring for
Yes.
hours.
I've seen it. Yeah, I
Yeah.
agree.
Well, yes,
It's
yeah.
very difficult.
um but I think the emails,
Oh,
we
oh,
all know.
Nikki.
But I think if people outside medicine think that we spend all our time sitting in a clinic talking to
How we
patients.
wish.
I was going to say, oh, that
How
that were
we would
true.
love that. No.
Well, I would love it. No, that's my favourite bit. When you're just completely focused, you're having a consultation and it might be difficult, but it's going well. That's fantastic. There's not enough. We don't have that joy, pleasure. enough anymore because we're sitting in front of computer screens. And when I went to medical school, that's not how I imagined. They barely had computer screens then. That's not how I imagined my career would be. And I don't know how restore. We need to try and restore more of that, as I said, human connection. But I don't know how we do that, and whether or not that's possible. AI. I need an AI bot
Absolutely.
Well,
to answer my
yes.
emails.
Well, I use Copilot. It's really great because it summarizes, what every
Yes.
email, and I do use that. It's great help for me.
Ah,
Um,
I might try that. I
mm,
haven't I
mm,
haven't tried that,
yeah,
but I might. Yes. Anything that makes life easier.
yeah, because getting 250 emails a day, yeah,
Oh, after a clinic, you think I finished my clinic. Used to be
no,
no. Now you've got
it's
to think.
terrible.
Now I've got to look at my emails. Yes.
Who is the next person you would want to open a door for?
I I think it's any colleague who doesn't feel that they're good enough. That if they go for this job, this role, that their imposter syndrome will find them out. They'll be found out. And I want to say, look, I was that person. Um, and and actually go for it. And it does, whether you're a doctor, a nurse, a medical student, a physicist, we can all help each other. We can all open those doors, particularly to those colleagues who feel that this isn't for me. This is I'm not good enough. Often it's those people who feel like that are definitely the best. So I'd like to open as many doors as possible, and I think you can do that just by saying to somebody, you can do it, because that's how doors have opened for me. You can do it, go for it. And
Yeah.
I think that's very valuable.
And what does healing mean to you?
Wow. I think healing is, so as a doctor, and you're you you hear the expectation is that you go around healing people, curing people maybe, but I think it's more, it I see it as more holistic. So I think, and this is very much on the top of my head, I think that I see families who are coming to me really distressed, who don't want to be here. They've read terrible things about radiotherapy on the internet. They are very fearful. Um, they don't want to engage in the whole. I don't want to be here. What I'm, they might even refuse to entertain the idea of radiotherapy, whether that's for themselves, whether that's for their child. And it's, so you start off having a really difficult consultation. I had a consultation once with a father who said, I'm not going to talk to you, and just slammed the door and went out. And actually, their part of their healing process is that they learn to trust us. They see that we can offer we can offer something to make them physically better, and by doing that, they get to a point of, I keep using that word, of trust, but of seeing actually that we are here to help them. And those families are the ones that come back, and they end up thinking this is all great. And I think going from that hostility to trust, to actually saying, isn't, you've helped us here, it wasn't half as bad as I thought it was. Families would often say, my child doesn't want to finish their radiotherapy, they've had such a good time. These are children that have that were, families that really didn't want to bring their child in. I think that's a healing process, that's sort of holistic. They've gone from a really difficult place to a much happier place, and it's not healing in a conventional sense, but I think that is something that is very satisfying, and we all have it, particularly in oncology, where people come to us and they want to be made better, and actually what we end up doing is giving them stuff that, with a long list of side effects, and at least temporarily we make them feel a lot worse. But coming out of that and seeing them having made their recovery, doing well, getting on with their lives, that's great. I suppose that's healing. I mean, healing in a personal sense, I think you have, life is a roller coaster, isn't it? And you have bad days, and that might be professionally, that might be personally, and you feel that nothing is, this particular, there is no resolution to this situation. It's terrible. And actually, as time goes by, those situations, facing them, the most challenging situations, when you get through it and you look back, you go, I did that. I managed to get through that. And that's very healing as well, I think.
That's beautifully described, because you describe a shift for
Yes,
patient and families, and an internal shift when we go through these difficulties, and how we process that. And again, self-awareness and kindness is so important. Frequently we forget to apply to practice self-kindness and self-compassion, because of very high expectations. I'm philosophizing now, I know, but
yeah.
it's
Oh,
the nature
we're
of our
all,
podcast, Nikki, so I'm allowed to. And
absolutely.
final question, anything that you feel comfortable sharing with us that is not common knowledge and you have not shared publicly?
Oh,
Oh.
uh, these these are the questions that are most difficult. So I don't think it's common on. My friends know, my family definitely is, my husband knows, it drives him mad. But I am a bit of an Archer's addict, I'm afraid. And so my part of my relaxation is to listen to all the banal stuff. Not all of it's banal, some of it is quite deep, that goes on in Borsetshire every Monday to Friday, and the omnibus on a Sunday. So I'll be happy. I'll happily listen to each episode twice. So, Filma, you probably have no idea what I'm. Well, I don't
No, no,
know
I
what.
She will Google that after we
exactly.
finish. She will have a look.
If you if you
It's
can
in.
explain us, Nikki, a little bit.
So, The Archers is a soap opera on the radio, and it's about everyday farming folk. And the reason that I got into it is my mother was an Archer's addict. And I think a lot. So you get to know the characters, and it's been running since the 1950s. And you get to know all the characters, and then something really, every now and then something really dramatic happens, and I can't remember what it was, but something really exciting and dramatic happens. It's about every 5 years. Most of it is about the village fete, and then it draws you in, and all of a sudden you think, I wonder what's happening on the Archers this week. So it's about 12 minutes a day, and you just switch. I just switch off completely.
Yeah,
It's
well deserved. Yeah. So it was wonderful, Nikki, and a lot of things that I keep from today's conversation, and it's the honesty, which is essential for a leader. It's yes, without that, I don't think anybody can walk far and have people on board with them. So thank you so much.
Thank
Yeah.
you. It's been an absolute pleasure. So thank you so much for inviting me to do this. And yeah, what can I say? It's been an honour and a privilege. And thank you for your carefully crafted questions, and just having an hour to have a nice chat with you both has been fantastic. So
We should do that in
much.
person.
We
Don't know
should.
when though. Glasgow,
We need
Spain,
another.
Madrid.
Yeah,
Madrid,
Spain.
Madrid, definitely
We should
wins.
go to Madrid, Nikki.
Yeah. Oh, yes. Yes.
It's a
I
win-win,
love Spain. Yeah.
definitely.
Definitely. Yeah, yeah. That
But it
would
was,
do.
and it was great. We didn't have enough time at the ESMO um,
No.
Wellbeing Day, but it was such fun, and it would be good. Maybe the next one. The next one should be in Madrid.
Exactly. Definitely. Yes, yes, yes. Nikki, thank you so much for coming. Um, you've shown us how much care goes into the everyday, the routines, the repetitions, the small things that build trust and allow treatments to happen. And it's a reminder that being a doctor isn't just about knowledge, it's about clarity, leadership, patience, and showing up again and again, always with care.
And to our listeners, keep opening doors for yourselves and for others. This is Dr. Joanna Nixon.
I am Dr. Vilma Pacheco Barcia from Open Doors Podcast.
And remember, you belong in the room.
You belong in the room.